Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical related information. I'm Dr. Adam Rodnick out of Commerce Township. We're here with our special guest today. We have Sanyam Sharma.
Hey.
And Sanyam is the CEO of Pontiac General Hospital, which is just reopened, was called Doctor's Hospital, and reopened with some innovative new things, with some innovative ideas, family business. And so we'd love to talk with you today about what is going on at the hospital, what you're doing for the community, and let's first just start off how you got into it. What brought you here to the state of Michigan?
Sure. Thanks, Dr. Rodnick, for having me. So, taking some of these one at a time, what brought us to Michigan was the opportunity. The family businesses, as you mentioned, are sort of related to the hospital business, but aren't related to one another previously. And so I have a background in mergers and acquisitions and stuff like that, management consulting. And basically I had come back to help out running some of the family businesses. And I had this idea that, if we can find a struggling hospital that can use some of the services that we already have, we really have a value proposition that we can bring to a hospital and, more importantly, the community that it serves. And that's what we found in what was then Doctor's Hospital. And we came in back in August in a sort of limited capacity, and by May 1st we'd closed the deal and emerged from bankruptcy. And here we are, fully operating. We never closed down, and we're opening up new services and stuff like that.
Now, it used to be Pontiac General Hospital years and years ago, is that correct?
Right, yeah, that was back, the name back in its heyday. It had been Pontiac General up until about the 2000s when it changed to North Oakland Medical Center, at which point, sort of at 2008, 2009, it had been changed to Doctor's Hospital when a bunch of doctors had acquired it and pulled it from being a nonprofit. And then those doctors owned the hospital up until we came in this year.
Now, in general, people wouldn't think of a hospital as, let's say, a family business or part of the community. Is that correct?
Yeah, so that's something that I think is a little strange, because inherently a hospital, or any, as you know, as being a chiropractor, any health profession is to serve the community first and foremost. I mean, businesses in general should do that, but it's a really direct link that a health profession is doing something for the community, and
Absolutely.
you do things for those you care about. And so as a hospital, any organization is sort of a family, but we see the hospital as a building block for the community, which we think is a larger family that we're here to serve. So
absolutely. I mean, my name is on my door. I'm part of the community. I live in the community. I want to help people in the community. I mean, I have a reputation to uphold, and I try to always put the patients first, which is what I've noticed so far with the hospital, is that everything you guys do is to put the patients first.
Yeah, I'm glad that you noticed that, because that's what we are actually looking for to accomplish from a business strategy perspective. I mean, we are not trying to sort of go really wide. We're trying to keep our focus narrow and really provide the services that the community needs. So, for example, I'm sure we'll talk about it more, but pain procedures. We really need to sort of take the drugs off the street and bring it back into a clinically administered setting. Mental health services, those are our focuses. And we think that the Pontiac, Waterford, North Oakland community in general really needs these services. It's underserved because a lot of bigger hospitals will come out and say it. Those are low margin businesses. There's low margin services, and we don't see the business that way. We say, if it's sustainable, if it makes sense and we can do it and help the people around us, that's what you need to keep the business alive.
And a lot of it, which I think is innovative, is outpatient. When people think of a hospital in general, they think you go to the emergency room, you may be admitted. If you're admitted, anyone in the hospital will come see you for depending on which specialty they are. However, you guys are also implementing a lot of outpatient procedures, outpatient specialties, like the pain clinic, like psych, like outpatient physical therapy, and coming soon, potentially outpatient chiropractic care in the hospital, which to me, I'm very excited about that. It's fairly innovative, that it's something more holistic, something that can be integrated as part of the medical team, the medical community, that patients will appreciate.
Yeah, I mean, it's going back to what we were just talking about. We are trying to provide those services that our patients can't find anywhere else that they need. Frankly, I mean, there are a lot of big hospitals that aren't going to move they don't see that doing these sort of taking these small innovative steps are going to move the needle, so they don't even explore that. We are willing to, for example, like you just described, we're looking to explore credentialing chiropractors. We want to bring in the PT. We will do the outpatient. And that's also a misconception that a lot of people have is, like you said, you come in through the ER or your physician directly refers you. But we're doing things a little bit differently. We have a 24-hour urgent care plus, as we call it, because it's not like a freestanding urgent care. It's attached to a hospital, so we can see higher acuity patients. So if you need to be admitted, you're a part of the hospital already. You can go straight upstairs if that's an issue. So we're able to do a little bit more than the urgent cares, while at the same time sort of getting through the bureaucracy of an ER where you're going to sit around waiting for 5 hours. We do it 15, 20 minutes.
And what's cool is you're setting up all these different specialties, and it's all centrally located as part of the community. So patients may have at some point go in for a consultation for the pain management clinic, and then let's say they get better and they're released, and then at another point they may go to urgent care, at another point they may go to a different specialty, or eventually outpatient psych, or some of the other different specialties that you have at the hospital, eventually going more even towards some of the things they used to have, like obstetrics or imaging, things like that as well. It's all centrally located. They can have one place that they can call their essentially medical home.
Yeah, I mean, a family needs a home, and we want to be that for the community. Like you said, a lot of outpatient services. So if you need some sort of routine pain management, we have partnered with Oakland Integrated Healthcare Network, a federally qualified health center, and they are helping us run our family medicine center. So you can bring the entire family to the hospital. And we do this for uninsured patients, for everybody. Really, we're trying to be as welcoming to the community as possible, and we're trying to provide the level of care to every patient as if you had, Cadillac insurance is what they call it in the business. We don't look at patients like that. We want everybody to be treated as a human being, to get the care they need, and to provide those services that they really need, instead of trying to, basically a lot of hospitals will hop you around and get you a lot of stuff you don't need. We want to be quick, efficient, and caring, and very, very patient-oriented.
Let's talk a little more about the Urgent Care Plus, because I know that's something that's a little bit different. It's very innovative. That's something that someone could come in and not necessarily have a long wait, correct? Like as if they went to an ER.
Yeah, we just renovated the outside area. The urgent care is staffed by the family medicine doctors, so you get a lot of attention there. And it's not, so there's a balance that you running in urgent care. A lot of freestanding urgent cares, their model is in the door, out the door. We just want them in and out. So yeah, you'll get fast treatment there. You get fast treatment.
No follow-up though.
No follow-up. You get quick treatment with us, but it's not the quick treatment that makes you feel like they're just trying to get rid of me, because we're not. And it's justified.
Hospital with different specialists.
Right.
If you need to be admitted, you're admitted. If you need to be referred to a specialist within the hospital, you're there.
We're trying to figure out what's really wrong with you, because maybe we can help you there. That's the idea. Instead of saying, okay, figure out who they need to see next, it's figure out what's really the problem and if we can help them here at the hospital, instead of just what can we do in this one urgent care setting.
So what are some things that they could see in urgent care compared to what some of the things they may necessarily not be able to go to an urgent care for?
Yeah, so a lot of times when you are feeling really sick, you can't go to a freestanding urgent care. Obviously, if you can't make it to any urgent care, if you have to go in an ambulance, you're not coming to our urgent care. But if you're feeling, sicker than usual and you need to see a doctor right away, and it's not just the common cold, or you just need an antibiotic prescription, you can still come to the urgent care. We can treat minor wounds and stuff like that. The most important thing is that you can feel a lot more safe at our urgent care, because, as we described, the ancillary services we have.
Part of a hospital.
Right. So that's the thing.
So it's neurological, orthopedic, psychological.
Right. So a lot of the outpatient care stuff, like pain, neurology, podiatry, everything. I mean, psychiatry, we can do any sort of medical inpatient work, a lot of services that we've got.
So we got a couple of clips of a few spots in the hospital that we like to show our audience, and so we'll go ahead and we'll roll those clips, and we'll speak over the picture and kind of explain some of the areas of the hospital.
Great.
That are building up.
Yeah, so this is sort of an outside view of the newly renovated urgent care. We're trying to sort of give the hospital a facelift because I know that just the word bankruptcy brings sort of fear to people's minds, especially when it comes to the healthcare setting where people think
if they're bankrupt, they must be bad doctors.
Right, or they don't have what it takes to take care of me, which we never close, and we're trying to communicate that. So this is a sort of a shot of the physical therapy space where we're doing all sorts of physical therapies. It's going to be added into our traumatic brain injury clinic where we can do them. Right now, this is the outpatient clinic, but we'll be able to do it inpatient, or we are able to rather do it in an inpatient setting and provide multiple therapies. We'll be doing speech therapy, occupational therapy, and so forth. This is a shot of also recently renovated pain clinic that I was alluding to. We have primary care physicians. We have a pain doctor that's on pain and anesthesia doctor that's on board. We have a number of orthopedic surgeons, neurosurgeons that operate with the pain clinic. So these services are really sort of a holistic approach to pain, which we want to add, to that suite, chiropractic services.
Which we're very excited to be involved with.
Right, and this is just a shot of an OR where we're able to do, everything under the sun as far as
and even though it's a small hospital, you guys are able to do some major surgeries. That's correct.
Right. So we're doing primarily outpatient surgeries just because of the volume we have, but we're able to do. We will be able to do inpatient surgeries as we have an ICU online, intensive care unit. So we can do, again, anything under the sun. That's
cool. Let's talk a little more about the psych clinic. Mm-hmm. And that's something that's very individual, and not many hospitals have something as unique as that and as big and broad as that. Mm-hmm. And where the patients come from and how you guys are able to take care of them at the best available care.
Yeah, so we have an inpatient psych unit, and a lot of them come from the emergency department that the city has called Common Ground. And Common Ground is basically a emergency room for psych episodes. And when they need
do patients admit themselves there, or do family members bring them there, or do the ambulance
all of
take
the
them?
above. Yeah, it can
ambulance
be anything.
Can take them too?
To Common Ground, I'm not entirely sure how they end up if ambulances rather can take you to Common Ground, but it's sort of a walk-in emergency setting. They have short-term care there, and when it's determined that the patient needs to be admitted for a longer time in an inpatient unit, they have several partners. We're one of their largest partners, and we are particularly equipped, again, because we're a full-service hospital, to be able to provide what they call med psych, so we can take care of non-behavioral health-related medical needs.
And so who sees the patients then? It's a psychiatrist, and then also the residents will be available as well, right?
So we have family medicine doctors. The residents are full doctors that can see patients if the medical needs arrive. Obviously, there are attending physicians that work with them, so you're actually getting more medical attention directly from MDs. But yes, the psych floor is managed and run by, from a clinical perspective, a psychiatrist or certified.
And let's talk a little about community outreach. What are some of the things you guys are trying to bring in and do for the community, to introduce yourselves to the community, but also to give back to them as well?
Sure, yeah. So we have, again, I can't say it enough, we have our eye to the community. That is how we're going to bring this thing back up, and are doing so. We have a number of things. So every month we're trying to do some sort of community outreach event. The first was a meet and greet. The last was a health fair. We have another health fair coming up in late August for back to school events, and we're partnering with Crystal Lake churches to do that. That'll help get physicals for the kids when they're getting back to school.
Oh, so they can go get their physicals right there, because a lot of people, I would say in general, in the community, neglect their health. They wait until there's a problem or they have
Right.
symptoms necessarily.
Yeah,
So
and that's sort of it's also educational, because a lot of people think that, well, they're first. I mean, and you said it perfectly. You go to the ER and you go to the hospital. Well, the proper model for a healthcare administration is you go see a primary care physician in a family medicine clinic, in your primary care doc initially, when you're not, extremely ill on an emergency basis, and they direct you to what you might have. They do tests and so forth and keep you healthy. It's a lot more preventative.
absolutely, and that's really what I focus on with our patients as well. Is we want them to maintain healthy spines, healthy nervous systems, rather than waiting until they're very symptomatic and they go to the ER.
Right.
And
that's what the way,
tossed off.
and healthcare legislation is. They've recognized that even at the governmental level. I mean, the business side has known that for a long time. I mean, it saves tremendous money both for the patient and for the hospitals and all healthcare administrators to have a more preventative approach, and that's what everybody wants for the benefit of all the parties involved. So if we can educate the community to say, you go to an urgent care on the off hours when you think something's wrong that can't wait to see your family care doc. If you need to go right now, if you're worried, you go to the urgent care. If you need to go to your family care docs, your primary care physicians, on a regular, semi-regular basis to make sure that you're staying healthy. So those kinds of things are what we're doing from community education perspective. The other front, we are creating an advisory board of community members that take people from all walks of life, ethnic backgrounds, socioeconomic conditions, and we're trying to give them a microphone, basically a way to communicate directly with me and other executive leadership at the hospital, so that we have our finger on the pulse of what the community needs, so that we're not just paying lip service, but actually working with community members, leaders, and just normal, everyday Pontiac, Waterford residents that need help and want a hospital that's there to serve them, instead of that's building fancy floor-to-ceiling window facilities.
And how do people get involved in that? And how many people do you have on that advisory committee? And how do they communicate? Is it through email?
Actually, I'll have a board meeting fairly regularly with this advisory board. We've selected a number of community members, and we are in the process of, courting them to see if they have got the time to actually come and do these things. But we're trying to, we tried to get as diverse of sort of cast as diverse of a net as possible to make sure that we're hearing from everybody.
That's excellent. I mean, you really don't think most of the time with a hospital that the CEOs are really hearing all the way down the chain to the people, and so it's really good to know.
I've given my phone number to people that just walk in the urgent care, and if they said that they didn't have a good experience, I come down there and I say, please come back. Here's my phone number. If you ever walk in these doors again, I want you to text me, call me, and I will be down here to greet you again. And that's happened 2 or 3 times at least.
Customer service is so important. I mean, even if someone has the best medical care, but they don't have the best customer service or way of talking or dealing with the patients may not understand the benefit. They may not necessarily understand what they're getting out of it, how important it is to keep up their health, and how to do prevention and maintenance. And so it's important to have good customer service and also, like I said, educate our patients. I'll see a lot of patients come to our office that may have had bulging discs in their spine for years and years and years, never did anything about it. Now all of a sudden they bent over to pick up the car keys, it's now herniated, and they went right to the ER, and they're maybe rushed in for emergency surgery or discharged with just medication. So they missed a lot of steps. They missed the whole step of seeing their chiropractor, which could have potentially prevented the whole problem in the first place. They skipped going to PT, they skipped interventional pain clinic, they skipped orthopedic consult, and they went right to ER. So it's really cool how you said with a centrally located place, they can get consults with any of those different type of providers along the way before they get to the point where it's just an emergency setting.
Right, and there's 2 things that are, I think, imperative for people to understand why that's the case. I think largely is that education, which is great for things like this where we get to talk to the community and talk about what good ways of taking care of yourself are. And the other thing is on the hospital side, which is I think more importantly, or any healthcare administrator, or any healthcare professional, is care. I mean, it's health care. If you treat patients as human beings and you really care about them, that's going to make them trust the system and want to come back and say, look, maybe I should go see my primary care physician more often. Maybe we can prevent these things. If they don't feel like, if they just feel like they're wandering through this big facility and aimlessly going places, they're not going to know how to get to where they need to be in terms of their healthcare journey. Where do I need PT? Do I need chiropractic care? And if
they have to have trust first.
Right. You have to trust what the doctors are saying, and the onus is on the doctors to make sure, and the administrators and everybody in the healthcare industry, to make sure that the patients feel as though they can trust you and that they're really going to get better by seeing you, and they're not just another pass-through, another customer, but rather an individual that needs help.
So now, how would you say that people, hearing what you have to say now, how would people now get involved? Let's say they want to, go see the primary care at the hospital. Mm-hmm. What's the best way for them to go about it without necessarily, like we said, going in through urgent care? Or if they do have problems with pain and they want to go for an interventional pain specialist consult, do they have to be referred to their doctor, or can they just call the hospital directly? Yeah,
they can call the hospital directly. We can have them see some of our doctors. We have primary care physicians. They can go, online to PontiacGeneral.com and find out all the information that they need.
All the services are listed on the website as well?
Right, yeah, and the phone number's there, and you just call registration and they'll direct you. You can go to OIHN, OIHN. You can find them online. You can look at how you can get family medicine help. PCPs, primary care physicians, are there to do the routine work that we were talking about.
Right on the website, they can book primary care appointments.
I don't know about OIHN. OIHN's technically a separate entity.
Okay, gotcha.
But they can find out how to get in touch with them and start doing work through there. Go online, call our registration people, get into the system. You will be treated with care, and if you're not, I'll know about it. And
he'll give you his cell phone, right?
Yeah, I'll give you my cell phone number.
And so, let's say people want to come and just to see the hospital. You said you had some times where it was a community day where people could come in, get tours, and see some of the hospital?
Obviously, our doors are open. Come during business hours, and you can see the whole hospital. Of course, the urgent care is open 24 hours a day, but a lot of the other services are normal 9 to 5, 9 to 6, 8 to 5, whatever business hours that the doctors are there for. But come through. We are more than happy to accommodate everybody. We want people to know about how this place hasn't shut down, and we're returning to the Pontiac General days, and that's why we changed the name again. Is back in the heyday, the name reflected that it was there for the community, and that's why we wanted Pontiac General.
The name of the community is right on the door.
Yeah. That's who we're here for.
How do people get involved when the back to school day? That'll be posted on your website as well, or Facebook page perhaps?
Yeah, so it'll be on the website, and there'll be, we're doing other marketing efforts with the Crystal Lake people.
Gotcha. Okay. Mm-hmm. We'll have flyers available for that in our office as well.
Great, thank you.
Absolutely.
And we look forward to, there's a lot of bureaucracy, and we try to cut that out, but in terms of working with you and other innovative, health specialties, we want to bring them in the door to, again, provide that holistic approach and give every single tool that's possible out there to get people better.
And we think that's incredible. In the past, 30, 40, 50 years ago, people would think of, let's say, chiropractors and medical doctors as totally separate entities. One will never work with the other. They butt heads, they fight. In my practice, we send a lot of referrals out to all sorts of different specialties, everything from neurosurgery to interventional pain to neuropsychology to psychiatry, and we can all work together. We help our patients tremendously with a variety of different health problems, but there's some things that we want to have a second opinion on, and there's some things we want to send out to, and vice versa. So we just want to be one piece of the puzzle. Chiropractic can be integrated very well with all forms of medicine. And so it's really innovative that, you guys are opening your eyes to that, and we can all work together for, most importantly, the betterment of the patient.
That's all
about the
we
patient.
can do. I mean, the more tools you have, the better you can attack the problem, and more specialties, more tools.
I know you were just telling me, we'll close it with this, that as far as the family atmosphere, you said you've seen now people that have come to the hospital that are 4 generations of people born at the hospital, huh?
Yeah. One of the big things before we changed the name was, when we were working with the hospital, before we sort of officially took over, we would say, working with Doctors Hospital, with people in the community, and they'd say, what? It didn't have that great of recognition. And then we would say, we'd say where it was, and they'd say, oh, Pontiac General, I was born there. My mom was born there. My dad was born there. There are people that work at the hospital, 4 generations born there. There's another lady that works in billing, 13 siblings, all born at Pontiac General Hospital.
Wow, that's amazing. And so when was the hospital first founded?
The hospital was first around in 1910. It's the oldest hospital.
Was it the only one in?
Only. It was just a house in Oakland County. The first hospital in Oakland County. It's the last independently owned hospital.
Oakland County?
Yeah, meaning that it's the only one that has doctors that are still a part of the ownership. Some of our partners are physicians.
Gotcha.
The rest are owned by big hospital systems that are
And a lot of
national.
are more state-owned, nonprofit, things like that, right?
A lot of them are not for profit, but very few are state-owned. I don't know of very many.
Gotcha. Well, thank you so much for joining us today. Again, we're here with Sanyam Sharma. He's the CEO of Pontiac General Hospital, innovative hospital, adding a lot of new things to our community, and we appreciate him being on our show.
Thank you.
This has been Ask the Chiropractor with Dr. Adam Rodnick out of Commerce Township, Michigan. Stay healthy.